start recording now. I've just started recording and
Mhm.
right. Tell
Okay.
us about the way to become FRCS and then a consultant in UK.
Well, so basically, I think everyone here is who have joined here is the MRCS aspirants. They are all, I think, living in their own country, dreaming to come to the UK. So I think I will start from the beginning, like how you can come to UK, how you can get the GMC registration, what are the pathways, and then move forward. And then at the end, I will take question, and then if there is any, yeah, if there any confusion, if there is any question, then I will take the questions.
Yes, sure.
So basically, to move in the UK, we have two pathways, like to get the GMC registration. One is the pleb pathway, and another is the MRCS pathway. Like if you do a pleb, then an OET or IELTS, then you will get the GMC registration. And if you do MRCS, then you do the OET or IELTS, then get the GMC. After getting GMC registration, then you will get the then you have to apply different places, then you'll get the job, then move in the UK. So surgery is a especially its subject, so it's not that easy like the medicine. So those people who are very very junior, like they started there and they passed the MBBS and 1 or 2 year with MBBS, then I would recommend them to come with the pleb pathway and then get the GMC registration and come in the UK, get the training post, and they make the surgery career very nice because there is very organized training here. And those are doing the MRCS, so they can also come with the MRCS, then join, then do their training pathway and the non-training pathway. And the training pathway, you can go with the UK training. You can apply for the UK training post, then finish the training, then become the consultant in the UK. A non-training pathway, you have to do the way I did. Like we came from the different countries, so we did. So now I'll tell you how you're going to do the FRCS. So first, when you come to the UK as an MRCS, and then you will need a recommendation from three consultant here, signature from three consultant. One should be your clinical director, and they will have to tell the Royal College that they have seen your work and you are eligible as a ST6 plus in the UK. Then you can apply for the FRCS Part 1. This is the requirement for FRCS Part 1. You need to have three consultant signature, and they has to recommend that your you know your work and your knowledge, everything is more than ST6 plus the training level in the UK. So, and then you can apply for the FRCS Part 1. FRCS Part 1 is almost like the like MRCS, like MCQ, 3 hour MCQ, and then 2 hours MCQ, total 5 hours MCQ in the same day. So when you pass the FRCS Part 1, then you are eligible to apply for the FRCS Part 2. There is no other requirement for that. And FRCS Part 2 is basically 2 days exam, all table vivas, like lots of vivas, 18, 20 station you have to face. Patients, there will be patients. So it's a very extensive exam. I will tell you, it's one of the difficult exam in the world. FRCS Part 2 1, the exit exam one. So when you will pass the exit exam, then you are FRCS. Then there are some requirement, like there is a Caesar applications. You have to. So those people who train in the UK, they do the CCT, completion of the training certificate. This is after FRCS. They ST at the level of ST8. They usually do FRCS, ST8, then they do a exam, it's called CCT, and when they pass that exam, then they will be the consultant in the UK. Or for those people who are not trained in the UK, like me, we do the FRCS, and then we have to do lots of paperwork, lots of paperwork, but it's doable. And then this paperwork, this means evidence that you are trained outside, but you have this, you have this level of training. You have led this evidence, so you have to submit all this evidence to the Royal College. Then they will scrutinize these things. Then they will say that okay, we have given you Caesar. Caesar means competency of certificate of the registration for the registration as a specialist. Then you will get the Caesar, and then you will be the consultant in the UK. That's it. It's so simple. Just you have to work hard, and
It's not that simple. Yes,
yeah, it's possible, ma'am. If you
it's
remember
possible. Yes,
2019 when I was talking to you after my MRCS one,
yes.
just just
I was telling them yesterday that 2019 he was sitting here like you are sitting. They were
mhm.
sitting there. So, but then okay, how successfully you went up to the top? That's the key.
Yeah, so this is basically just work hard. And UK, if you can come in the UK, it's a blessing. I will tell you that it will not leave you empty-handed. UK is a mother of all the whatever you say, that it will give you with all her blessing hands. But you have to work hard. If you work hard, there is no everyone in the UK, whoever comes, everyone gets these things. Like everyone get MRCS, FRCS, Caesar. These are just it's a you'll get everything with the flow. The flow will take you. The education system, training system here. The consultant will always poke you. Why you are not appearing FRCS? Why you are not doing career progression? If you don't do career progression, you need to answer lots of questions. So it's a just flow. It will take you to there. Trust me. Just you have to come here. That's
That's
it.
good. So, what is the time lapse which is required by the Royal College when one passes MRCS
Mm-hmm.
B and before they appeared in FRCS Part 1, Part
Okay.
yeah, 1?
Yeah. So, ma'am, I think there is not that much time limitation, but I will tell you uh, this is the so level of competency what you have. Like those people who are coming. So I'll tell you whoever listening here. So I'm from Bangladesh. So I passed my FCPS in 2011 because I need to give them a background. Otherwise, they will think that it's it's not sometimes that easy because I had a good background because I was trained in Bangladesh. So I passed FCPS in 2011. Those who are from Bangladesh or in Pakistan, they know what is the FCPS, how difficult this exam is. So and then after that, I practiced as a consultant in Bangladesh 8 years. So I was basically an independent surgeon. I didn't have the issue to learn surgery and get competency these things. I already know these things. I just have to use myself with the system here. So that's why let me tell you two things. Who those are like me who are already trained in your country, so they can easily follow these things. So suppose when I came here after 6 months of working here, the consultant I approached to the consultant, can I get your signature? And they are more than happy. They say, no, you have very good knowledge. You work very nice, so we don't mind to give you signature. But I have seen people working 3 year, 4 year, 5 year, even didn't get the signature from three consultant because they don't have that much competency. So it will depend upon the competency. Like if you can do the surgeries independently, like laparoscopy, cholecystectomy, appendicectomy, not cholecystectomy, laparoscopy, appendicectomy, then laparoscopy, cholecystectomy, laparotomies, and everything. Surgery register is a very basically very responsible post here. If you can manage everything very independently, very nicely, then you will get the signature. These people are not that mean. They will, if you know it, they will let you do. If you don't know it, they will teach you. And then if you think if they think that you are competent, they will sign you. It's not that issue. You don't need to, you don't need to run after them all the time like in our countries. So if you know, they will do. If you don't know, they will never give you. So this is the another thing. But in our countries, if you are related to the consultants or professor, they will sign you for everything. This is not like that here. If you know, you will get it. If you don't know, you will not get it. But they will teach you. It's not like that you will never get it. So the thing is that those who are juniors, I will tell, like just started their surgical career and the learning phase. So I will recommend them to come in the UK and get the training post. Get the training post like ST3. ST means specialty training post, training register, or start from ST1. It's a very nice training system in the UK. Every year they have a target. They will teach you all the operations. They will teach you the how to do research. They will teach you how to train the juniors. Everything is very very well organized. And if you get the training number, then within 4 or 5 years you will be consultant in the UK. So if you are trained in your country, come here, and then they will see whether you can do it or not. If you can do it, if you are very well trained, like if you they're happy, then they will sign you for FRCS, and you will go for the exam. You will get it. And if you are not trained in your country, no problem. No worries, you will come here, they will train you, and when you will be ST6 trainee, then you will be eligible for the FRCS exam, then you will get the FRCS exam. So that's it. It's that simple.
Okay, we have a question in the chat for you.
Mhm.
Dr. Usman wants to know, he's a consultant general surgeon, which path he should follow.
Okay, so I'll tell you, in our country, consultant, if we pass the FCPS or MS, we straight become the consultant. So in this country, the consultant is a very very big term. This is the last stage of your career. You are consultant mean you are the top of the rank. Like in our country, it's a professor. I don't say that professor and consultant in this country are the same. It's not like that. But in our country, like assistant professor, associate professor, and professor, this is the highest post. In this country, consultant is the highest post. So so basically, with due respect, Dr. Usman, I don't know what consultant level you are like, whether you have become consultant 1, 2, 3 or 5 year. I don't know, and how your competency are, how your competency level, like how good you are in doing surgeries. That's the important thing. So if you are very competent, very good. So I will recommend you. Oh, not even recommend. You have no other choice. You have to come to the UK as a. You have to do MRCS. For you, I'll tell you. You have to do MRCS. Then you have to get the GMC registration. Then you have to come to the UK as a register. Then you will work as a register there. Register here. So remember, in register in this country, the as the has the same competency like in our country. The registers are very the senior registers. They are very very. They handle everything here, especially in the emergencies, in the routine theaters, everything. So if they see your work, at least give them 6 months to 1 year, and if they're happy, and then they will sign you for the FRCS exam. You need 3 consultant signature, and one must be your clinical director, and then another 2 consultant. Any consultant would be in your trust, but your clinical director must be sign you, otherwise you are not be eligible, because a GMC will send all the letters, recommendation, everything to the clinical director. So after that, then you are eligible to sit for the exam. It's there is no time restriction for that. Basically, like after MRCS, you have to wait 1 year, 6 months, 2 year, 3 year. It doesn't matter. You just need 3 consultant signature. They have to say that they have seen your work. They are more than happy you to recommend you as ST6 plus. So I will tell you about this ST6 1 2 3. So basically, in this country, specialist training starts from ST1, 2, 3, 4, 5, 6, 7, and 8. After 8, and then you will be consultant. So after ST6, they after ST6, they will recommend you to appear in the FRCS exam. Within ST8, you have to complete the FRCS part 1 and part 2. And after ST8, and then you will finish the CCT and you will be consultant. This is the training route. But as we are not trained here, those who will not be in the training post in the UK, they will come here and they will get signature from the three consultant who will tell them that they have seen your work and you are as a level of ST6 plus. Then you will can appear the FRCS exam and then you will apply for the Caesar after your FRCS. So the same thing I'm repeating, the same thing because the basic, so many people will tell you so many things. The basic thing is two way. One is get a training post in the UK, then with the flow you'll be the consultant. 1, 2, 3, 4, 5, 6, 7, 8. After 8, by the 8 you have finished your FRCS, and after 8 you will apply for the consultant in the UK. But those not trained in the UK, they'll come from the different countries, work here, and the consultant will look at their works. If they're happy, then they will sign you for the FRCS. Then after FRCS, you will apply for Caesar application. That's it.
Right. Dr. Imon Hassan wants to know what material you used for FRCS1.
Oh, FRCS one is for materials is like uh, the EFRCS, the main thing, like EMRCS, the same. You have to take the EFRCS subscription, the same as EMRCS. And then there are two book. We tell it green book, and one is one green book, and one is yellow book. And
There is a name. I think.
oh, sorry, these are the FRCS exam, intercollegiate FRCS exam question bank by the Oxford Medicals.
Okay.
So these are the things basically. And there are some online subscriptions. So
Which
you have
one would you
just
recommend? The past test is also selling, and EMRCS people are also selling one. Which one would you recommend for
no,
them?
I will recommend the EFRCS, the one from the
EFRCS.
Royal
Okay.
College, like the authentic one,
Yes.
EFRCS. So but ma'am, first of all, I will tell them first you need to think whether you are eligible for FRCS or not. Because I will tell you one thing, from 2026, sorry, 2026, after two
Yes.
year, there
Yes.
will be no international FRCS. The
Right.
internet, there will be no,
Oh,
uh,
sorry. Yes. It was a new.
yeah,
I'm sorry. Yes. Continue.
yes, yeah, there will be no international FRCS. So I'll tell you, there are two type of FRCS. Let me tell you this. One is from the JCIE, Joint Intercollegiate Examination, which is run by like three colleges, Royal College of England, Ireland, and Glasgow. They together take this exam. It's called JCIE, which is recommended by the GMC, and you must have to this FRCS if you want to do the Caesar application. If you want to be consultant in the UK, you have to do this FRCS, JCIE FRCS. Another FRCS is JCFE FRCS, which is the FRCS which usually you can take from the India, Pakistan, Bangladesh, like not even coming in the UK, you can take this exam. But remember, my friends, these FRCS you cannot apply for the consultant in the UK for that FRCS. So I will recommend you not to go that pathway, because this FRCS will be just ivory. You can use just behind your name, at the end of your name, but there is no value of this one if you want to be a consultant in the UK. And they're going to stop this FRCS in from 2026. From 2026, there will be no FRCS from from like that's JCFE. if it sounds, if you don't understand this one, you can ask me. I can tell you again. So there is two FRCS. One is JCIE, JCIE, and one is JCFE. So the JCIE FRCS is the FRCS which is recommended, which is the FRCS you have to do. And if you want to do that FRCS, you have to come to the UK. You have to do an MRCS first. You have to work in the UK. You have to get signature from the consultant in the three consultant in the UK, and you have to do. Then you can apply for the FRCS. So those who are asking me, if you are not working in the UK, so I don't think there is. So you cannot apply if you are not working in the UK. You cannot appear that FRCS JCIE1. Sorry, I think if you are confused, you can ask me because I have to make it more clear to you. So,
Okay, I have posted the links in the chat. You can take the links. The first link that I've pasted above, it's only for the show go. You want to show off in your region that you are a FRCS or you're something so that you can do until next year. The other one is the real game for that you would must have to pass MRCS and then after
you have
1
to
year
work
of
in the
training.
UK.
Yes. Is it 1 year or is it more than 1 year?
Ma'am, it doesn't matter. You have to, if you work in one day only and you get the signature from three consultant
Right.
that they have seen your work and they are happy that you can appear in the FRCS, then your job is done.
Right. One
But
of them said,
even if
yes,
you work 5 year
yes,
or 10 year, you don't get these three signature, then
yes.
this is for you. This is for someone for 10 years work, but they will not get
Mm.
the FRCS.
This
So this is
Dr.
not
Ali,
something.
yes,
Yeah.
Dr. Ali Hayat is asking, can I get competency signed from his Pakistani professors or supervisors, or
I'm
does it?
sorry. No, it's a no. You can do that. You can do that JCFE1, but not the one. You have to do MRCS. You have to come in the UK for JCIE one. The one which you need for the to be consultant in the UK.
He says he's already qualified neurosurgeon in his country. Okay, good.
Yeah, that's
Right.
good. But
Yeah,
JCIE, I have written here in the group JCIE. This is the one.
yeah.
This is the one you need
This is the
if you.
one I have sent it here above the second link.
Yeah, yeah,
JCIE. Yes.
yeah. This is the one you need if you want to be consultant in the UK. And this is the one you will need to do an MRCS. You need to come in the UK. You need to be signed by three consultant. So, but there is no time restriction for that. But other one, there's one JCEFE. This one is basically international FRCS. Uh, this one is basically you don't need to come to the UK. Your consultant in your country can sign you. Who have the FRCS, they can sign you for the exam. You can appear in the exam, and then yeah, you will get the FRCS. But just it's a show off. You can write in you with your name, but you cannot apply for any job or anything in the UK or not in the Middle East or anywhere
Yeah.
because it's not recommended anywhere except I don't know except where, but not even in your country because in Bangladesh I know, but if you cannot even write that FRCS after your name.
It's not going to give credit.
No,
Dr.
it's not
Ali
Hello.
going.
Hayat has a question.
Hi. I just unmuted myself because I was a little confused from the answer. I wanted to ask it with my voice.
Yeah, please. Yeah, it's a bit confusing. You can ask
As,
whatever, how many times
as,
you want.
as you just said that you were also an FCPS qualified surgeon and worked as consultant in Bangladesh and
Mhm.
all the competencies of a surgeon. And then you said that after getting three signatures from the medical directors, I wanted to know those medical directors were of UK or Bangladesh? If they were of UK, then you had to actually.
No, no. Remember, so I think you didn't follow whole. So basically, I was consultant in the Bangladesh. Then I did MRCS and moved in the UK, and I worked in the NHS. After 6 months of working, I got three signature from the consultants in the UK, not Bangladesh.
Okay, and for that you must have done a non-training job for some time to get those.
Exactly, exactly. I got the. I'm sorry. After my MRCS, I got a registered job in the NHS. I worked here as a register. And after 6 months of working, then I approached to my consultant here, and they were happy and they gave me the signature. Then I applied for the FRCS Part 1.
Thank you so much. Then that's a good news because it can save a lot of time. Because I always thought the training
Mhm,
that I got as a qualified FCPS surgeon is going to
mhm.
go waste if I go to NHS England after MRCS. But it's a good
No,
news that.
brother, there, you training in your country, in our country, doesn't mean any sense here. Trust me, doesn't mean in zero sense here. But with the training, the quality you got, like the competency you got in your hand, when you will show them these things, I believe that when you will work as a register here in 6 months or 1 year, they will definitely sign you off for the FRCS because there is no value for the paperwork. That's fine, I understand, but there is a high value of work. If they see your work, they will 100% value your work. Okay, so
Thank you
don't
so much.
don't get disappointed that you wasted your FCPS. You didn't waste your FCPS. This is your main thing. This is your foundation block. Like you made a very good foundation. Now we'll just take the advantage here.
Thank you, Dr. Jahangir.
No worries, you're welcome.
Dr. Sadia has one question. She's asking, no, sorry, it's Dr. Maham. If you have completed training in your home country, how hard is it to enter general surgery training at ST3 level?
So basically, I told you in this country, everything is like everything is transparent. So you will just apply for the training post here. There are lots of boxes. You have to tick the boxes. Like whether you have this publication, then one box, okay. You have this audit, one box, okay. You have this competency, another box, okay. Just tick boxes. And when you will complete all the tick boxes, then they will call you for interview. If you can show them your competency, then you will get the training post. I have seen lots of British people, British trainees, like worked 3 4 5 years so every time they failed to get the training number. But I have seen people coming from like us, different countries, just applied for the training number, they got it. Like I will give you an example. Miss Sarmin ma'am knows my wife is from Bangladesh. She got a training number in cardiology, which is the most difficult subject to get. She got in one chance. She just applied and she got the number. She got the interview. She got selected. So here quality matters. It doesn't matter where you're from. Okay?
He actually got before you
Yeah,
managed.
yeah.
Right. Another thing is actually why they are asking. There are people running Facebook groups and other social media platforms, and they have created a chaos. They give this fake image to the people that it's very hard to secure a job. So that's why they are freaking out.
Yeah, so basically, yeah, it's hard to get a job, especially in the surgery, because surgery is very difficult. But I will tell you that example, like when you came to the world, you are so lucky because thousands millions of sperm fought like, and you became the winner. You came to the world, then you survived, then you got the in a medical school, then you got your MBBS. So you are lucky in so many ways. So that's doesn't matter. Basically, if you can show your potentiality, you will get jobs. Now the problem is that most of the people just run for the jobs without getting proper training, without getting good competencies. So that's the problem, creates. So that's why they don't find the opportunity to get secure a place here. But those who have competency, who have good quality, they will definitely get a job. It doesn't matter. There is always opportunities.
Dr. Ahmed has got a question for you. How can he improve his CV for better opportunities, considering that he's a fresh graduate, just completed internship and passed MRCS exam?
Yeah, so basically what I will recommend you, do a ATLS training, ALS training, and do the basic principles of surgery, surgical basic skill courses, eh, and join different national and international scientific conferences, seminars, do paper presentation, do a audit, do a publication, and keep yourself busy in surgery training. Like, don't, you did MRCS, that doesn't mean, it's a good, it's you have got a certificate, but you need your, you need to improve your skill. You have, so always keep yourself busy in a tertiary level, very busy hospital, that you got lots of opportunity of working. So just work more, like make your skill up to date, and then none of your time will be wasted. Like if you come in the UK even after 2 years, and then if you get this surgery training in your country 2 years, so it will be valued here. Like if you can show your work, then they will just sign you off for the FRCS. You don't need to start from ST4, 3, 4, 5, 6. You will straight go to the ST6 and 7.
Right, good. Dr. Ahmed Awad asked you if trauma and orthopedic FRCS is the same.
Yeah, trauma and orthopedic is a different from the general surgery, but trauma and orthopedics, I have some my colleagues, they are doing in trauma and orthopedics. It's a very good future here, because in the world there will be lots of accident every day. So trauma and orthopedics is always it be a top subject.
Highly competitive as well.
Yeah,
get
yeah,
into.
because yeah, everywhere is competition, ma'am. So I'll tell all of my fellow colleagues, don't think about this competition things. Everywhere is the competition.
True.
So you have to survive with the competition. So don't. So if you think there is no competition in this subject, then you have to remember that this subject doesn't have any future prospect, or doesn't have any even value. That's why there is no competition there. Okay.
True. Even the most useless
Eh,
specialty is also overcrowded.
exactly. So it's not like, but there will be competition everywhere. Even in your country, when you do MS or FCPS, is it less competition? Is competition everywhere.
Dr. Ali Hayat has a question. You can unmute and ask.
Yeah, yeah, you can ask question.
Yeah, I want to know because I've heard people saying that to be eligible for FRCS neurosurgery, one has to have many research publications, audits, QIPs, and even MSc in the neuroscience. How true is that?
Yeah, yeah, it's correct. Yeah, because if you, but remember, this thing sounds.
What happened? You are muted.
Yeah. So, are you in the UK, or are in your home country?
I'm in my home country.
Yeah. So basically, if you come in the UK, my friend, these things are very QIP audit. It will be very easy thing for you. You will see every day you are doing this. This MSc things also is very easy. Like the part-time MSc, you can do it at your home, and you will get the funding from your trust as well, because there is lots of funding from the trust. Yeah, so you have to come to the UK for these things. Basically, if you come here, I never heard of audit. I never heard of QIP before coming here. When I came first here, I was just shocked. What is these things? I don't know anything. Now I have so many audits, so many QIP, and I'm the supervisor.
MashaAllah, very nice. And today I really feel blessed and thankful to ma'am Samreen and you for motivating, guiding, and all the answering all the questions. Thank you so much.
Thank you.
You're
Dr.
welcome.
Jahangir has always given us time, so we are blessed to have
No,
him.
no, I am blessed.
No,
Basically, I
Dr.
want.
Jahangir, you have always given us time, so
No,
we
no,
are
this is
really
my,
thankful.
they don't know what you did for me, so
No,
they
that's
don't know
okay.
because, yeah. So I'm always happy to come whenever you call me. So basically, yeah. So I'll tell
Dr.
everyone not
Usman
to
has a
get
question.
panicked. Yeah, yeah, please.
You can unmute Dr. Usman and ask.
Hello, Dr. Jahangir.
Yeah, yeah. Dr. Osman, nice to meet you, sir.
Thank you. Can you supervise us for audit in our home country?
So, no, I am here. How can I supervise there?
Uh, Give us the guidelines how to do audit.
Oh, okay, okay. I can send you these things. I can tell you, or Miss Samrin ma'am can arrange one session that
Can.
how can we do
Yeah.
an audit.
Maybe
I can
after
do these
Ramadan?
things.
Yes.
Yeah,
Okay,
yeah.
thank
After, so remember, Dr. Usman, these are very, very easy. Don't get panicked. These are, you know, what I'll tell you. These are so easy thing. I was also like you guys. I was so scared of these things.
you. Okay.
So I'll just give you an example. Suppose, just some simple example. Suppose you are using a ciprofloxacin for ceftriaxone. Sorry, ciprofloxacin for UTI. So you just do these things. Then in your CB it will be a big point. Like you have done ATLS in this year, you have done ALS this year, you have some basic life support training. You have attended this conference, you have presented this conference, you have these publications, you have this QIP, you have this QU audit. You see how big your CV is now.
Yeah, but I don't have any publications. Here, I don't know, like, people are not very interested to do these things.
So you have to, if you want to, improve your CV, you have to do this. But if you come in the UK, you must have to do these things. Every year, you will have a appraisal meeting, like you will have a meeting with your supervisor, and they will tell you next year your target is to do this two audit, do this one QIP, do this publication. You have to attend this conference, national conference. You have to attend this international conference. Director, whoever can write this that you were in a full-time study here from this time to this time. So so that's it. Or you can give the certificate where it should be written that from that date to that, and then you can do rest of them. So the thing I will recommend you while you are waiting to come in the UK, while you are waiting, so don't waste your time there. Just don't think that when you go UK, you'll do that. But start doing from today in your country, and it will be valued.
Okay, thank you so much, Dr. Jahangir.
No worries. You are welcome. Okay. Any question?
Assalamu alaikum, Jahangir bhai. How are you?
Assalamualaikum. Hi, sir
Alhamdulillah.
Mahmoud.
Yes, brother. So I'm working in Africa like 9 years as a senior medical officer. So after getting GMC, do you think it's like too hard to get a job there?
No, no, it's not hard. You have to just keep applying, and you have to just improve your CV. Like you have to use your. Suppose I'll ask you within the nine year, have you done any audit? Have you done any QIP? Have you attended any conference? How many conference you attended? How many conference you presented?
No. Like internally, we did some audit in
Yeah,
our
yeah,
hospital,
that's good.
but the conference I haven't
Yeah, so
participated any.
yeah, so start doing from today, and it will improve your CV. So that's the thing we are lacking. We think that we'll just do an MRCS or PLAB, then apply, then we will get the job. So it's not like that, because the world is getting more advanced, very competitive. So those who are ahead of you, they will get the job. So because, so you can easily do these things. You can easily do some training like ATLS, ALS. It's it's happening around your in good places in your country. If you just keep an eye on that, you will get lots of
Yeah,
opportunities.
we have those opportunities.
Your second audit cycle, you will tell them, now after first cycle, after this education, after this education to the doctors, now our guideline, they are 50 among 50 patient, 40 of them got ciprofloxacin. So there is a massive improvement. And then after this audit cycle, so I am finishing my cycle recommending that ciprofloxacin is good for UTI, and we have to adhere with these guidelines. I'm just giving a simple example, okay? Start from the very simple. This is called audit, man. This is nothing.
Okay.
So audit means that what is your national guidelines and what your doctors are doing. Just follow this thing. Just you have to do an audit, that whether they're following the guidelines or not. If they're not following, then why they are not following. Educate them and do the second cycle. That's it.
Would someone
Yeah, then you can this is the beauty of the audit. Then after your 2 cycle or 3 cycle, then you can make it a publication. Then it will be a publication. You can
okay,
publish it in any journal that you have done this audit and you showed these things, and these things we should follow. So this will be your
okay,
publication.
That is
okay.
how they maintain quality assurance.
Yeah, this is the QIP. QIP means the same thing. QIP, quality improvement project. Like whether when you are giving local antibiotic, when you are giving local anesthetic, do you check the expiry date? So you will just do an QIP project that you have seen junior doctors, they are not following the protocol of checking the expiry date in the local anesthesia before injecting. Okay,
Okay.
do an audit. Like if you see 50 patient for UTI, you will see how many of them got ciprofloxacin. And if you see there in 50 patient, only 10 or 20 patient has received ciprofloxacin for their UTI, and rest of them have received different antibiotic. So just this is finish your first cycle, and you will recommend that among these only 10 person, 10 doctor prescribed ciprofloxacin for UTI, and in 50 patient, 40 patient didn't get ciprofloxacin for UTI, so they are not following our hospital or national guidelines. Okay, then after that you will train the doctors, like you will tell all of the doctors, dear my friend, you are not following the guidelines, can you follow the guidelines, like prescribe ciprofloxacin for UTI. Then after 3 months you will see again 50 patient, and you will see that how many of them got ciprofloxacin for UTI.